With only 7 days left to the end of a deadline given to government to increase salaries for doctors, as agreed last month, the Uganda Medical Association says it is yet to receive any communication on the commitment of government to meet the doctors' demands.
We needed, of course, serious commitment, and government should think about this, the consequences of not valuing their human capital.
The State Minister of Health for General Duties, Opendi, has asked the doctors to be patient.
I think I must say it's very unfortunate that we are taking on this trend. We have been very clear. Cabinet on Monday considered enhancement of salaries of public servants across the board. And we discussed nothing apart from that for the whole day. We made some recommendations, and tomorrow, Saturday, Cabinet is sitting. We are having a special Cabinet meeting to conclude the issue of salaries.
Recently, government also committed to provide drugs and other inputs that have been lacking in public hospitals around the country. However, according to Dr. Obuku, only Kirudu and Kawempe hospitals have received the supplies.
We are beginning to get reports again of shortages in certain areas, especially up-country hospitals. And in certain departments, patients have already resumed buying their own supplies.
Government provides just about 48% of the medicines that we require in this country. So we cannot just rise up now when Parliament has even been on recess.
No, I was just hearing, but I don't think so.
In turn, doctors had also gone on strike, and the Ministry of Health had pledged to pay them 940,000 shillings as gross salary. But the president of Medical Interns, Dr. Robert Lubega, says some of the interns have not received the money, even as they wait for a pay rise from government.
Case in point is Tororo. Our colleagues have not received this money. And we are engaging the ministry, however, nothing has been done yet.
It is true, but it was because they went on strike and some of them were not on duty. So that was the reason. But we have reached out to them and asked them to actually pay the interns their money, because industrial action is really a legal process.
Dr. Obuku revealed that Uganda Medical Association has petitioned the National Security Minister, Lieutenant General Henry Tumukunde, over the conduct of the Health Monitoring Unit under the Ministry of Health, which has been accused of harassing doctors.
We are thinking of a rehabilitation program. If you get a doctor in a certain hospital, you are arresting him, you are putting him on the media, and then you find this doctor is innocent. To reintegrate that person into the community, to still hold that respect, is very difficult. Some of these members, we have called them, we have cancelled them.
But of course, the Health Monitoring Unit cannot go and arrest any doctor who has done nothing. There must have been a basis for which these arrests are conducted. So I also want to appeal to the Uganda Medical Association that this Health Monitoring Unit was put in place by His Excellency the President. He has received your complaint. Allow him to look into this.
On the issue of government importing doctors from Cuba, Dr. Obuku argues that it's not necessary because every year 650 medical doctors, and also who include specialists, graduate from various universities. He said the major challenge is that working for government or working in government hospitals is not attractive enough.
You advertise, they come, they pass the interviews, but they cannot be retained in Karamoja at 900,000.
In fact, we will include them in our plans for industrial action when they come, because they will understand what we are going through. We will make them the grand commanders, okay, of the industrial action. It may even be more effective because they'll bring in international tactics.
It's still an idea on the table, but we have not concretized or had any further discussion on the matter.
It remains to be seen what Saturday's special cabinet meeting will resolve on the issue of doctors' remuneration and whether the doctors will accept what government places on the table. Sudil Biarhanga, NTV.